recording now.
Hello, this is SheSplain. We don't ever do that.
Hello, this is SheSplain. Ew. Oh, it could be like an NPR podcast.
You're listening to SheSplain on no network. We are independent.
Yeah.
Radio podcasting.
Independent.
I'm Bree.
I'm TL. Guys, it's hot.
Oh my god.
It is so warm. Right now, Bree and I are sitting in my very warm kitchen, and surprisingly, this is not the warmest it's been this weekend.
I'm actually not sweating that much right now.
Yeah, I'm not terribly warm right now.
I'm mildly damp.
The back of my knees.
Yeah,
Those
that's
are...
right. Are you ever just sitting on your couch, and then all of a sudden your ankle feels wet, and you're like,
oh, yeah.
and then you're like, oh, that's sweat that has dripped down from the inside of my knee because I am disgusting.
That happens to me all the time. I am a very sweaty person.
Me too. So right now I work about a mile and a half from where I live, and people are like, oh, do you walk to work? And I'm like, no.
Ew.
Do you not realize, this is a mile and a half. Yeah, it's a mile and a half. And if I lived in New York City, that would be one thing. But this is a mile and a half in California with no tree cover. It's just streets, no trees. And you want me to walk a mile and a half in 100-degree weather.
With the sun.
So that I can literally just sit in my dried sweat all day?
Ew.
I'm a very sweaty person.
I'm one of the sweatiest people I know. I've always been sweaty. My entire life, I've always been a very sweaty person.
Me too.
I grew up in Michigan, and it's not like this there. It is not like California, even a little bit. And when I lived in Florida, I feel like it still wasn't that bad.
It's only 93 right now. But when I was in my car yesterday driving over to the Glendale area, and it was 106, my car said, and I was like, yeah, that sounds about right. Because I feel like I'm about to melt into my car seat.
Yeah. So anyone that says global warming isn't a thing can friggin' fight me.
Yeah.
Because this is too much.
I'm getting a little concerned about my cat because, I've seen these threads on I belong to a couple of cat groups on Facebook. And people are, one that's a LA local one, and people are like, do you guys leave your AC on all day for your cat? And, the opinions on this are so polarized. There's people that are like, how could you not leave your AC on? This cat has fur on its body and blah, blah. And then other people that are like, well, cats have a higher core temperature than humans.
Yeah.
And they're not as hot as you think they are.
And cats can regulate their body temperature very differently than even dogs.
Right, exactly.
I can't leave my dog home alone without having the air conditioner on, but I think that cats are a little bit different in the way that they're structured.
I think they are too, and they tend to they know they're really good at finding the coolest place to be.
Yeah.
And the weird thing is that sometimes I'll put the AC on and it'll be on in the living room, and she'll just be hanging out in another room that's hotter, and I'm like, okay, clearly it doesn't bother her, because if it did, she would come out and sit in the cooler room.
Yeah. She's probably not excited about it. But
she mostly just lies around. She's but what difference is that from her normal behavior?
I'm just slightly more uncomfortable.
She just looks like she just does really flat cat.
I
she's
love
just
when cats do that.
So flat on the ground, just as low as she can get.
I like when my dog does that, but I can still see his ears because they're so big, and they just point straight up. He's been super dramatic with the heat. He's
I mean, so have I. I can't really blame him.
Yeah, me too. I talk about it all the time. That's the only thing I talk about is how warm and uncomfortable I am.
So
my office, at least I'm the only one there, so I can have the air conditioner on however I want it on.
Yeah.
So that's nice, because sometimes in an office environment, it's too cold.
Mm-hmm.
And you can get sick from that. I used to get sick all the time in college because our building's temperature was 70 degrees at all times, but then it was 100 degrees outside, and going back and forth from that is not good for you.
Yeah, I've worked in offices where I had to bring a cardigan every day, and I would get so cold, my hands would be so cold, and I wouldn't be able to type that I would have to make tea just to warm up my hands, so that sometimes I would go run my hands under hot water, just like bring feeling back to them so I could type. I don't understand how that's comfortable for anyone.
No, that's not comfortable. No. I hate that. Matt has to wear a hoodie to work because it's so cold. But I guess they have a lot of equipment, so they want to keep it.
Yeah, I get that. But also, you don't need the whole building to be really freezing.
No, just have your studios cold.
Yeah, or wherever you're keeping the equipment.
Yeah.
So,
I don't.
Whatever.
Also, I can't really function very well, so.
No. The other night, I got home Friday night. I was a little hormonal too. And then when I got home, it was so hot still in the apartment because the air just like doesn't circulate that well when no one's home during the day because we don't leave anything on. We leave a couple fans on just so the air is moving a little bit at least. But I got home and it was so hot and I was like kind of cranky already. And I just was like, I'm just going to go to the movies. Like I have to just go be somewhere cold right now.
Yeah.
And it was worth it.
I bet it was.
And then by the time I got home, it had cooled down a little bit, so it was nice.
Yeah, that is nice.
Yeah.
The first thing that I do when I get home is I open the back door and I open the front door because, like, yeah, that air, like, that just, like, really still hot air is the worst. And then I take off all of my clothes and I lay on my bed.
I wish I could do that, but my roommate is my roommate.
Oh, yeah. Can't really do that.
And I think that would be weird for him.
Yeah.
Like, I've been sleeping in a, like, little shorts and a bralette lately. But, like, to go to the bathroom in the morning, I, have to put something on because I don't want to make him uncomfortable.
So your roommate used to be my roommate, too?
Yeah.
We all lived together. And one time, it was a really hot summer again.
When Bud came out in his boxers?
Yeah, but he forgot. It was just...
Because we were also just, like, out of it because it was that hot.
It was just warm. But he had them... He was in his boxers, and that was it all day. Like, all day. And I didn't think anything weird of it because I've always lived with, like, a lot of guys at one time. And so that's kind of just, like, normal. I actually thought it was a little weird that he had never done that before.
He still doesn't do it.
But he remembered, like, and you could tell when he remembered because he got this, like, panicked look on his face and then he ran to his bedroom and put clothes on. This is a person who won't run to the store unless he's fully dressed. Like,
yeah,
it was just really funny.
I'll be like, if I'm wearing a bra, I'm acceptable to be in public.
That's how I am. Listen, like, I went to Target today and I went to the pajama section because, like, pajamas are usually, like, a lot lighter material and fabric. And so it's just, like, I'm going to get some, like, comfy jammies that I can just be really sloppy and loungy in. And if I have to, like, go to the store in them, that's cool. Or if, like, somebody knocks on my door, that's fine. And I'm wearing one right now. It's a Marvel
Is
romper.
It a onesie?
Yeah.
Cute.
Except the top is so big. We were just talking about this.
Women like us are never gonna. We're never gonna fit perfectly into one pieces.
Oh, I can do that.
Oh, there you go. You could always just tuck it in. Like,
I mean, I can take it
inside a little bit.
Yeah, I have a few things that I have to do with that. So yeah, it's warm. I'm uncomfortable. I'm always complaining about it.
Yeah.
I don't know if you've had this happen to you, but I'm like between a 10 and a 14. More towards like a 10 and a 12. So I'm an average size person.
Yeah.
In California, I'm obese, which is just, that's for a whole nother episode. Whole nother episode.
We were talking about the other day with why, like, nobody serves, like, the average American woman's body. There's, like, 2 stores. 2 stores, that's it. Yep, that's it. That serve above 12. And one of them is for old ladies.
Yeah, exactly. But I've had people comment on why I'm so hot based on my size. So I've had people tell me that the reason why I'm so warm is not because I just run warm, which I do, but because I'm overweight.
I mean, there's so many reasons why that's wrong, but like one of the big ones is like the people that I've always known to run the most hot are usually like really slim people.
Yeah.
Right?
Yeah.
Like in my experience, it's always like guys that are really tall and slim run like crazy hot.
Yeah.
So I don't know where that logic is coming from, but also just like no.
Also, are you
a doctor?
Yeah, you're not a doctor.
You a doctor?
Don't tell me how.
You don't need to talk about my weight if you're not a doctor. Like literally ever.
Since I can remember, I've always felt this way. And California is just like that much hotter than anywhere else I've ever lived. And even when I was thin and living in California, I still felt like warm all the time.
Mm-hmm.
And maybe like just trust people, just trust that other people know what's happening in their body.
Yeah. I mean, yeah, that's what we're going to talk about today.
Yeah. That's what we're transitioning into.
Yeah, because there's this huge bias, especially with women, but like I said, people that are overweight or whatever you want to use to say that. Because I know different people prefer different terms. Some people want to be called fat. Some people want to be called overweight. Whatever you want to call it. We're not going to mince words necessarily today. And then, how other biases play in. And these are things that have been proven, but we're not going to start talking about the statistics and all of the study stuff because my biggest experience with this sort of thing is my personal experiences and what I've heard from other people that I know. And we need to believe women and their experiences and listen to them because they're real and they're valid. And
especially when it comes to our bodies.
Yes.
And like knowing what's going on with our bodies.
Exactly.
We need to trust that people understand that there is something wrong.
Right. Like, who's going to know what's going on with my body better than I do?
Exactly.
No one. Because I'm the one living in it.
Exactly.
Right?
So that's our episode today. And next week, it's all about doctors. And it's called Please Believe Me, Doc.
Oh, is that what we're calling it?
Yeah. I just made that. So let's go with it.
Okay.
That's what we're calling it.
Yeah.
So we reached out to a few people to ask them their stories about doctors not really necessarily trusting them or believing them. We have a few stories of our own that we're going to tell too. And, we wanted to, I feel that this is one of those things where you start to think that you are, I don't want to say making it up, but you start to feel like invalid.
You do get gaslit sometimes.
Yeah.
Because if you try to pursue something and figure out what's going on with you and nobody is taking it seriously or treating it like there's actually something wrong and that there could be a solution, even if they're treating it like there's something wrong but they're telling you there's no solution, there's nothing they can do, you start to feel like it's like it's pointless and it's not real, like what's happening to you is not real. And that's, it's
something that happens a lot more with women than it does with men.
Absolutely.
It's something that happens a lot more with women of color than it does with other people, and also in the trans community as well. And
yeah, and a lot of that just comes from the fact that so much of the medical knowledge that we have as a society is based on studies that have been done with white men as the subjects. And I don't have any particular statistics for that, but that's something that's known. Like there's a lot of studies done where it'll be just white women, and that's something I've read about before, and you're just like, you can't possibly be
getting a full picture of what's going on if you don't have a representative, if you don't have a subject pool that's representative of the population.
Yeah.
Because then you're just studying something specific to one type of person.
Yeah.
And I think that's where a lot of this bias comes from is just there's not enough knowledge behind to diagnose people that maybe don't fit with what's been studied.
Mm-hmm. Yep. And unfortunately, I think that in some cases it's also, this is not most, I don't want to get into it like a hashtag not all doctors.
Yeah.
But sometimes doctors use their own personal prejudice or bias to judge what's happening. And so
exactly
that plays a part too. Yeah, which is unfortunate and the exact opposite of what you're supposed to be doing as a doctor.
We'll definitely talk about some real facts and statistics behind that.
Yeah.
A little later or in the next episode. I don't know.
However we cut this together, because this is our podcast.
Yeah, just trust us, okay?
Just trust us.
Okay, so why don't you start by telling us one of your experiences that you've had that is part of this whole issue.
I have a good one. So the first year that I was in college, right when I moved to Florida for college, I had only been there for a few months. Well, probably 4 months, but it wasn't long enough for me to really care about getting a doctor. Also, I was a child, so it wasn't my main priority. And I started to have really bad stomach pains one day, and I knew that it wasn't normal because I have a history of kidney stones, and the pain was similar to that than anything else. And so I went to an urgent care, and the first thing that they asked me at the urgent care, which I guess I can justify a little bit, was if there was any way that I could be pregnant. And so I told them that while I was sexually active, I had just ended, my period had just ended a few days prior to that. And so no, I didn't think that I was pregnant. Before I could say anything else about, hey, I used to have kidney stones, maybe we should check this out, they were like, okay, well, you need to take a pregnancy test. Yeah, and so I took a pregnancy test. I wasn't pregnant. Part of this pregnancy test, it was just a regular pee on a stick pregnancy test.
Yeah.
And also, as I've said before in this podcast, I monitor that so closely because I'm terrified of being pregnant that I knew I wasn't.
Yeah.
I just knew I wasn't. And just to kind of get that out of the way, okay, we can be done with this. Let's actually figure out what's going on. I didn't mind. And so I sat down and I was waiting for about an hour to see someone, which I guess isn't terrible at an urgent care, but there was no one there, so whatever. And when I finally saw the doctor, the first thing that he did was make me take another pregnancy test. And so that was another pregnancy test that you a regular pregnancy test, and then they drew blood for 2 pregnancy tests. Both of them said that I was not pregnant, by the way. And I'm not even sure why he took the blood test. Because it's not something that you can just, at an urgent care, that you can just, go.
Just, pop it in a machine and
it's
pregnant.
Yeah. I got results later saying that I wasn't pregnant.
You're like, thanks, that's so fucking helpful.
Yeah, you're just wasting my money at this point. And so the doctor was like, well, if you're not pregnant, there's nothing that I can do for you.
Oh my God.
And I was just there's really, nothing else that you can look for. There's no other symptoms that I'm showing that, could be anything else other than pregnancy. So he ended up sending me to an ER. And,
great.
Yeah. So I was in the ER, and once again, the first thing that I was asked was if I was pregnant. I told them I took 2 pregnancy tests, that my period had just ended. No, I wasn't pregnant. At that point, I wasn't even, allowing them to question if I was. I wasn't, okay, maybe I could be. I was just no, I'm not pregnant. I took 2 pregnancy tests, I'm not pregnant. Because I wasn't going to do it again. They made me do another one before I would see anybody. That one said I wasn't pregnant. I don't remember how old I was at this time. I think I was 19 still. But so I was waiting there, and it took an hour for somebody after I'd taken the first pregnancy test to approach me and ask me if I was 100% sure that I wasn't pregnant. I said yes. They made me take another pregnancy test, and then they left me because there was no doctor that could see me at that time, which just wasn't true. Like, there were a ton of doctors. I don't know why they were waiting. I think it was because it was stomach pains, which tends to not be, like, something serious. Like, it's, like, gas or, I guess, to them, I'm pregnant. So I waited for...
Except for when it is.
Yeah, and so I waited for 4 hours for them to come back to me, and they're like, oh, well, just so you know, the doctor that we want you to see isn't scheduled until tomorrow morning. And it was like, well, it's... At that point, I think it was 7 p.m. And I was like, so what do you want me to do? And they're like, well, you just have to wait here until 11 a.m. tomorrow to see someone. By the way, take another pregnancy test. We just want to be sure. I have never taken so many pregnancy tests. Like, no one has. That's weird. And so I was just waiting, and, like, the pain kept getting worse and worse. And I was telling them this entire time that the pain was getting worse. And nobody would see me. There were doctors that would, like, walk by me, and they would stop for a second, and they would ask me what my symptoms were, and then they would walk away.
I mean, like, here's the thing is, like, do they not trust that a girl of 19 knows the difference between what a fucking cramp feels like? Which is probably what would happen if you were pregnant, unless you're literally giving birth.
Yeah.
Which it would have been obvious that you weren't at that stage of pregnancy.
Yeah.
But, like, you're 19. You'll know if you're having cramps or not.
Yes.
That's something a doctor should just be able to trust. Like, I'm not going to go to the doctor if I'm having cramps.
No. And
or the urgent care.
Yeah.
Or an emergency room.
I think that I vaguely remember them just, like, giving me Tylenol when I first got there. And it, like, they expected that to just kind of, like, help and make it go away. And then it'd be like, oh, bye. It was so frustrating. So I was waiting. They had me on a cot in the emergency room. Like, it wasn't a gurney, so it wasn't super high, but it was definitely higher than, like, just a regular cot. And I was waiting, and I think it was, like, 11 p.m. or, like, around, like, a little past 11, and I passed out, and I fell off the cot onto the floor, and that's when a doctor was finally like, oh, maybe we should check this out a little bit more. My appendix burst. Because I, like, had appendicitis. Mm-hmm. And if they just would have checked that out, I wouldn't have had my appendix burst. You can die from that.
Yeah.
I'm not trying to, like, make this a much bigger deal than what it was, but you can definitely die from that. And if someone would have just listened to me from the very beginning when I said, I've had kidney stones, this pain is similar, I'm not pregnant, we would have known what was going on.
Yeah.
Not to mention, once I had my surgery, I never saw the doctor after. Like,
because they were embarrassed?
I don't know. I still have no idea what that doctor looked like. I didn't see him before I went into surgery, and I didn't see him after.
Wait, so they didn't come in before your surgery and be like, this is what's going to happen?
No, I had to go straight into surgery.
Shit.
Because...
And nobody followed up with you?
I had nurses, and that was it. I never saw a doctor.
Ugh,
I saw a doctor outside of my room, and the nurse, like, was like, oh, this is, they were talking about me, and then he was like, oh, go check on her, and that was it.
Okay.
Yeah, so.
Right. Love it.
Thanks for almost killing me, Doc. That was nice.
Yeah, thanks a lot.
There's my short little story about how no one listened to me and just assumed I was pregnant.
I'm glad you didn't die.
I'm glad I wasn't pregnant.
That too.
That would have been really shitty if I actually was after all those pregnancy tests.
Yeah. Ugh. Gross.
Yeah, it was really gross.
One of my favorite
experiences that I've had. It was like a couple of years ago. I've had breathing problems my whole life.
Me too.
Since I can remember. I don't remember when it started. It probably wasn't my whole life, but it's been a long time. And at one point when I was in high school, we went to the doctor and they tested my lung capacity and they decided it was fine, but they gave me an inhaler anyway. And then when that didn't really do much, they gave me a daily inhaler, which didn't do anything either. And eventually I just stopped taking them and then I dropped it because I was like, this is just my life. And for a long time I thought that it was related to, and I think it may be somewhat, because I was very thin. I had a small waist, but large breasts. And that's a lot of weight, and it's really hard to have good posture, which then I think in turn affects your breathing if you don't have good posture. And like, there's so much connected. So when I got my breast reduction in 2006, wow, that was a long time ago, I thought that would help, and it did help a little bit because obviously my posture improved when I didn't have as much weight on the front of my body, just like weighing my shoulders down. But it's just, and then since then I've gained, I don't know how much weight, but a lot. I weigh a lot more than I did, and again, my breasts are bigger, so it's a lot more weight being carried on my shoulders, and it affects my posture. But a couple of years ago, it just got really bad. I don't know if it was like a really bad summer or something, because of course the weather affects how you breathe. And I had a new doctor that I really liked, and she listened to me, and I was like, maybe this is the time to bring this up because, it's just something I've been dealing with for a really long time and blah, blah. So she did some kind of test, some kind of heart test just to like rule something out. And it had some like weird things come up. So she was like, okay, we'll do like a heart monitor for a full 2 days and we'll see what happens there. And then when we did that, she was like, okay, because there's nothing really wrong with your heart. It's just there was something with that first test. It might have been the way they set it up or whatever. When we did the 2-day thing, nothing really came up, and my heart seemed fine. But she sent me to a cardiologist anyway, who did some more tests and decided that I was fine. Then they sent me to a pulmonologist, which is like lungs, I guess, mostly that they deal with. And they did a lung capacity test, but it was a more involved one. Like, how when you go and get a lung capacity test, they just have you blow on this thing. Yeah. And it just it's like a quick measurement. This was a way more involved one with this big machine where there were multiple tests that I had to like breathe in and then breathe out for a certain amount of time and like try to hit certain notes or whatever on the measurement. And so I took that test, and while I was doing it, the guy was like, the guy that gave me the test, which was not the doctor, was like, are you sure? Like, you can breathe more than that. And I was like, dude, I'm doing my fucking best here. And then
you can breathe more than that.
He was like, can you breathe more? Can you get more out? And I was like, this is my breathing. This is why I'm here. And then he also made a note that I was wheezing because he kept pushing me and was like, breathe in more and breathe out more. And I was like, at my capacity. And I would be like, and he would be like, breathe in more. And so it caused me to wheeze because I was straining so hard to get more air in and out. And so he made a note that I was wheezing. And then when the pulmonologist looked at it, he was like, well, you're wheezing, but your lung capacity seems fine. So I don't think there's anything wrong. Well, and the first thing I said when I went to the pulmonologist was, I have trouble breathing. Inhalers don't work. Please don't prescribe me an inhaler. It's not going to work. And what does the guy do? Jesus. Prescribes me a daily inhaler. And he wanted me to go pick it up for $70 prescription. And I was like, no, give me a sample. I'm not going to take a gamble on this thing that I already told you is not going to work. And then when it didn't do anything and I went for my follow-up, or it might have been the cardiologist that's told me, one of them at some point, and it was a male doctor, told me that my lung capacity was fine and my heart was fine and there didn't seem to be anything wrong, and that usually when women have problems like this, it's psychological, so I should probably get a referral to a psychologist.
I don't know how I would have reacted.
I was raging so hard.
Yeah.
I was, like, beyond words that I just, like, I think I just stared at him. And I was like...
And when women, like...
I didn't go back to that person because I was like, this guy does not think I'm a real human.
But what that says about him is that he's not going to take anything seriously that a woman brings to him.
He didn't believe me.
Because he already has this idea that it's in your head. Prior to you even coming in, he looked at your chart and saw you were a woman, and he thought, like, it's probably in her head.
And then I have this other dude that's like, oh, you're wheezing, but your lung capacity is fine. Let's give you an inhaler, even though you've already told me that doesn't work. But it's a waste of my time and money. So I just I dropped it. I was like, you know what? Once again, 10 years later, I was like, I guess this is just my life. I'm just going to be breathing like this. Nobody believes me. Nobody has a solution. All anyone ever does is give me an inhaler. And, like, along this whole process, nobody once said, hey, have you gotten fitted for a bra properly? Or have you tried physical therapy to strengthen your back because I can see that you have large breasts and maybe that's causing strain and on your posture, which is causing your breathing to be... like.
Well, no, because breasts are wonderful and there's never anything wrong with them, and they can only be good, pleasant things to have, right?
All they wanted to do was just give me a fucking prescription. It's like... Since then, I did some... like, when I exercise more, when I do yoga more and my posture improves and I'm, like, my body feels good, I can breathe better. Mm-hmm. And I have started doing some, like, really intense posture improving things. I won't really go into it much, but it's called foundation training, and it, like, works on alignment without having to go to a chiropractor. But it was designed by a chiropractor, so it has all of that stuff, like, as the basis for it.
Yeah.
And since I started working on my posture really well, and also on how I breathe, because they taught me how to breathe better through, like, the, like, more in my back and the back diaphragm instead of, like, trying to breathe more in the upper chest. And because breathing it's not natural to me the way it is to some people.
Now that you're describing it, I'm like...
You're like, maybe it's me, too. Maybe I have the same problem.
Yeah, I'm, like, trying to do it.
Well, because,
just, like, listening to him.
Yeah. But, like, you can't actually breathe like that without having good posture, because when you slouch, I think it constricts part of your diaphragm, like, in the back, and, like, the part that goes from the back to the front, you know?
Yeah.
So it's all connected, but since I started, like, changing the way that I hold myself and everything, I can breathe better, even in the heat.
Yeah.
Like, nobody ever...
Thanks, doctor.
Nobody suggested any kind of just really basic shit to me.
Well, no, because it was in your head and you were making it up.
Right. Yeah.
What another thing that bothered me about that story was that the guy who was running the test just wouldn't trust that you were at your capacity.
Yeah, no.
And kept pushing you further and further. And I understand that the point is to, like, get to that capacity. But it's also to stop at that capacity so that doctors can see where your true capacity is. Because if you're uncomfortable, how does that help?
Yeah, like, I'm not going to be able to breathe like that, like, everyday normal. So if that's not my normal, why do you want to test beyond that? Like, it was literally causing me pain to breathe that way. It was so uncomfortable. Like, how is that helpful?
It's not. And he just, like, wouldn't believe that you were done.
He was like, why are you wheezing? I was like, you fucking tell me, man.
Why are you wheezing?
I don't know.
Because you're not doing this right. Why are you getting paid if you can't do it right?
Bananas.
That is bananas. I don't
like
that.
That was my favorite part of Baby Driver, by the way, when the girl was just like, that's bananas. BANANAS.
I didn't see it. I really want to.
Yeah,
I mean, this is totally off topic.
Okay.
I like it a lot. Edgar Wright is one of my favorite directors and writers. I think he's really talented, and I love him as a storyteller. I just wish he would once in a while write a female character with some kind of depth or substance. I love him, but, like, he could do it. He's a great writer. There's no reason not to.
Yeah,
I don't understand why he doesn't.
No one's pushing him to. No one expects him to.
But, like, imagine if his protagonists were women, how great those stories would be.
Yeah.
It's just... Ugh. That's the noise I make when I'm frustrated. I sound like a Muppet. I'm a frustrated Muppet, which would be a really good name for a band.
Frustrated Muppets. There's a fly in here, so if you hear him buzzing...
Go away, fly.
Go away.
You're not welcome here.
You're not welcome here. So another story I have is from my mom, who you guys know now from the Mother's Day episode. So my mom has been, this is going to be another conversation that we should have. My mom's been overweight my entire life, not even her entire adult life, just my entire life. Mm-hmm. And I blame part of that on genetics and part of that on, like, she didn't grow up with a mom to kind of, like, teach her, like, this is how you should eat healthy or whatever. Yeah. And also, like, right during the 80s when she kind of started to gain weight, that's when food changed in general and the chemical makeup of food. So there's a lot of factors that go into that, but it's not for a lack on my mom's part at all for, like, not trying. Mm-hmm. She has always tried something to help her weight issue. And I was living here. No, I don't remember what year it was. A few years ago, my mom decided to have gastric bypass surgery for it. And a lot of people are weird about gastric bypass surgery. Like, I understand that some people are, like, totally against it. Yeah. I'm not one of those people. I think if, like, you've reached your limit and there's nothing that you can do and this is going to help you, then, like, do it. And it wasn't something that, like, she just ran into. Like, this was decades in the making.
Right.
So...
You don't just make a decision to have major surgery like that on a whim.
No.
No one does.
No, and during that, like, at this time, they're a little more lax about it now, which I think is kind of weird. But at this time, you couldn't just, like, there was no way you could do that. A lot of places weren't even offering you to do that without a year of therapy prior. So it's intense. And I think that my mom, prior to that, had waited a while to do that because most doctors, it is, like, last case scenario, but most doctors would not believe that she had tried everything.
Of course not.
Before that, because, you know, why believe her about it? But she ended up getting a doctor who was like, oh, okay, it's not good for you to have all of this weight on your body. You need to have, like, the surgery is going to be beneficial to you. So she went in for the surgery, and while she had the surgery, they nicked her spleen.
Ooh.
And the bleeding was pretty bad, and she almost died, but they got it under control. So on top of having a major surgery that's going to change your body immediately, she had, like, another traumatic thing happen to her body.
Yeah.
On top of it. So, like, great start going in, right?
Mm-hmm.
And when she got out of surgery, she was, like, really sick. And I think maybe at this point it was because of the spleen. On top of having gastric bypass surgery. But she was so sick to the point where she couldn't eat anything. Even what, like, you're supposed to be eating after gastric bypass surgery, she couldn't eat at all. And then after a couple weeks, it was so bad that, like, she couldn't do anything because there was no nutrients coming into her body. And she kept telling people, like, there's something wrong. Like, I can't, like, I'm sick. And she was, like, anything that she would eat or anything that went into her body, she would throw up immediately. Mm-hmm. She was in hospice for a long time because, like, nobody could figure out what was wrong. And I don't think it was that nobody could figure out what was wrong. I think it was that there was a lack of want from the doctors to actually be like, oh, well, maybe it's not just, like, in this lady's head that there's something wrong.
Right.
That it's not, like, it's not just her being uncomfortable.
Well, they make a lot of assumptions based on the situation. Like,
Exactly.
instead of looking at it from an objective point of view, they come from their experience too much, I think, sometimes.
Exactly.
And that can be really dangerous.
Yeah, it is dangerous. Like I said, she was, like, in a hospice. Like, nobody expected her to get better. It was only like, oh, you're going to be getting worse. And this is it. Like, that's it. And doctors didn't care. Like, they kind of stopped caring. Or not caring. That's the wrong word. They stopped trying to find a solution.
Mm-hmm.
And then she got she got kind of a new doctor when she ended up being moved from the hospice back home, I think. I'm not sure what that step is. I asked her if I could tell this story, and she was like, yeah, go ahead. But then I didn't ask her how it actually happened. So this is just from my memory. So she ended up getting a doctor that was in our hometown. At this point, she was in a different city than what we were living in. And this doctor was like, well, gallstones are actually, like, gallbladder problems are a huge thing that happen to people when they have this surgery.
Mm.
And a symptom of that is gallstones, like like nausea and throwing up and vomiting.
Right.
That's a symptom of gallstones, and that's what was wrong with her, was
Yeah.
that she had gallstones, like, on top of having gastric bypass surgery, and that was it. That was all that was wrong with her. But 25% of people that have this, they end up having gallstones.
And nobody checked for that?
Nobody checked. No one checked, and this wasn't a short process. This was 6 months.
Wow.
And nothing was getting into her body. Plus, she had this surgery, and it got so bad that she lost muscle, and she has nerve damage now from it. And all, like, one doctor had to do was say, like, oh, like, this isn't in your head. Like, you're not throwing up. This isn't psychosomatic, which is what a lot of people kind of thought, was that it was psychosomatic from having the trauma of the surgery. But that it's gallstones, and we can remove them. And as soon as they did that, as soon as they figured out, she was fine and she was able to eat. But she was in a hospice, not being able to walk. Like, she can still barely walk. She can't feel her fingers anymore because of it.
Yeah.
Because, like, no one would listen to her.
Ugh. That's just... Ugh.
It's so frustrating.
Yeah.
But, like, just... She kept telling them that there was something wrong. And because, like, these doctors were, at the time, like, the only doctors performing this type of surgery,
Mm-hmm.
they trusted themselves more than they trusted their patient.
Yeah. Well, like, I guess my mom said that when I mentioned that we were doing this episode, she's like, she asked what I was doing this weekend, and I was like, oh, we're recording SheSplain, and she's like, oh, what's the topic? And I was like, how do I explain this to you in 2 words? But anyway, she's like, oh, well, you know that when your grandmother had a heart attack, the doctor didn't believe her.
My God.
And I was like, what do you mean? I guess, like, part of it is because the symptoms of heart attacks that are publicized so much and that are commonly known, like the type of chest pain and, like, what like, especially how it's pictured in, like, movies and TV and stuff, how we see it portrayed.
Like, where the guy's like,
and
then he grabs his chest.
Yeah.
Yeah.
But they only recently started, like, publicizing, I know that's not the right word, but, you know, like, informing the public about the symptoms that women have, because it's actually, it's different.
Yeah.
Women have different symptoms than men for heart attacks, and this would have been, like, at least 20 years ago. So at that point, even the doctor, like, wasn't treating her as a woman.
Yeah.
It's
He was
like,
looking at the symptoms that they had been testing
yeah.
on men. Or not testing, but they had been gathering data on men.
Right. Yeah, and that's it's crazy.
Thanks, Doc.
Yeah.
Thanks for that.
Mm-hmm. Mm-hmm.
Thanks, Doc.
We should maybe hear
Should we hear a listener?
hear from some people other than us. But, like, what does it say, the fact that just you and I have several stories just between us. Just between our experience. And I haven't even finished with my stories yet.
Yeah.
I got more. You gotta wait for it.
It makes me sad.
Yeah.
It makes me sad and it makes me frustrated. And it kind of makes me not trust doctors myself.
Ugh.
When that's supposed to be a relationship that you can rely on.
Yeah, I've had some really good doctors, and I've had some...
I have a really good doctor right now. Her name is Dr. Metropolis, and I love her.
Oh, hey, Doc. I have a really good doctor right now, too, because I have PCOS, which we'll talk about later. I have to go to, or I prefer to go to an internal medicine doctor.
Yeah.
Which is generally, like, someone that mostly knows, like, old people stuff, but they're really good with, like, hormones and that sort of thing. Because it's at the heart of it a hormone disorder, I guess. So I go to an internal medicine doctor, and she's really, really great. And, like, every time because I switch insurance or whatever happens, like, every time I've gone to a doctor that's not an internal medicine doctor, they don't even know what PCOS is. And
like, I know that PCOS isn't super common. I know
that. Oh, but it is, though. That's the thing. It actually is way more common than people realize.
That's what I was going to say, but I feel like it's more common than not knowing what it is. Like, I knew what it was.
I think it's 10... I think the latest thing I've read is about 10% of women, but I have to check that. It's absurd.
Okay, so we're going to listen to a couple of the people who emailed us back with their stories.
Mm-hmm.
Which, thank you for doing that.
Yeah, we're really excited to share some user-generated content.
Yeah.
That's what I'm going to call it.
User-generated content.
Because the thing is, so many people have stories like this, so I think it's really important to share them because people like us need to realize and understand and feel that they're not alone in this experience, and that, you know, like, we have to advocate for ourselves, and you have to remember that it's not just you.
Exactly.
It's really easy to forget and just fall into that trap of being gaslit and thinking that it's just you and you're making it up and nobody believes you. If nobody believes you, it can't be real. So that's just not true.
Nope,
we believe you. We're here to validate all of these people and you. We believe you. We believe your truth.
Thank you. All right, let's listen to a couple.
This is Bri Seely, age 34, coming to you from Los Angeles, California. I began to ask my doctors at the age of about 24 to be sterilized. I have known forever that I don't want to have children, and so every year at my annual exam, I would ask about it again and again and again, and every year I was told without fail that it was impossible. No doctor would ever perform the procedure for me. I would inevitably change my mind, that I was too young to know what I wanted for my life and for my body, and I was just constantly turned down and told no. They didn't believe or trust in me enough to know that that was my truth. And I understand that there are some complexities with it and that some women do change their minds. And at the same time, it was incredibly frustrating to be a woman who knew exactly what she wanted and be unable to have her wishes fulfilled because the medical industry didn't want to take the risk. And so finally, at the age of 29, I stopped waiting for permission from my primary care doctor and just scheduled an appointment on my own with a specialist that would actually be the one to perform the procedure, and went in, after 6 years of asking again and again and again, went in to see the specialist, had a consultation with her, brought in my diaries and my journals from the last 6 years, like documenting all of the things I needed. And it was, I think the most frustrating thing for me is that, as a woman at the age of 29, I had to prove to them that I knew what I wanted. I had to prove to them that I was clear-headed about this and I was making a rational decision, whereas any man or boy can go in, even at the age of like 20 or 21, and ask for a vasectomy and not even be questioned. I think that's the thing that gets to me more than anything. I've heard story after story of guys who have gone in and gotten vasectomies, no questions asked. And I had to fight for it for 6 years and bring proof and documentation and, you know, have really well-crafted, thought-out answers to their questions.
Ugh.
This type of situation makes me so angry.
Mm-hmm.
Because I've heard that many times from people. You'll change your mind.
Oh, yeah.
And I've looked...
Even if you're not, like, trying to do any kind of procedure.
Yeah.
If you're just saying, like, yeah, kids is not something that I want.
Yeah.
People always have an opinion on that.
Mm-hmm. And I've looked into this. And it is such a process that I've just, like, given up.
Mm-hmm.
And she mentioned that a guy can go in, no questions asked, and get a vasectomy, and it's fine. It's totally fine. And it's because, like, it's because our perception of women is that they're supposed to have children.
Yeah.
They're supposed to want to be moms. They're supposed to have, like, that Mother Earth feeling when they're pregnant and, like, really enjoy it and want to birth babies.
You're made to feel like an absolute freak if you don't want kids.
Yeah.
And if you're not made to feel like a freak, you're basically told, like, oh, well, you'll change your mind. Like, well, that's just how you feel now. And it makes you feel like a child because it's like how when you're a kid and they say, oh, you'll get it when you're older. You'll understand that when you're older. Mm-hmm. That's how you're treated when you're 25 and you're saying, I don't want kids.
Yeah.
They're still treating you like a child.
And also, the fact that she had to bring documentation and proof that she didn't want children. To me, the only proof that she has is I don't want children. That's the only proof.
I mean, just make her sign something. Or, I don't know, like, that just says, this is my decision. I am not being forced to do this.
Yeah.
Like, I don't know. Like, there's just no...
The only thing that I can, like, comprehend maybe a little bit is, like, I went and saw a therapist and we discussed it at the end, and that way it's not like there was something going on at the time that was much deeper.
Right.
But that's it. And I don't think that there should be anything else that's required of women to make that choice. I mean, we should just believe when women say, I don't want this for my life. The end.
Right.
Like, there's nothing else. There's no more to it.
And then you had women in the Ford as late as the 50s, I think, that were being sterilized without their knowledge.
Exactly.
And then
that's cool, though. That's cool.
Yeah, that's fine.
That's totally
especially
fine.
Because it was particularly women of color that were being targeted for that sort of thing.
Mm-hmm.
But, I mean, not getting totally off topic, but just, like, why is this never a woman's decision about her own body? Like, we always have to bring so many other things into it.
Yep. And why is it so easy for men to make that? Why is it so believable for men to make that choice? And it's so...
Because we don't trust that women know what's good for them and their bodies. Like, that is, like, why we still have all these white dudes making all these decisions politically about what women can and cannot do with their own health care. Did you just growl?
I'm seething with rage.
Yep.
Well, that's a terrible situation to be in when you want something for yourself and you know you want it and you just can't. You have to go through other people in order to get it.
Yeah.
And when you do that to people who know what they want and know what is good for them, and you still deny that for them, and the only reason is just that you're denying it because you feel like they're going to change their mind or that this isn't right for them, they're still going to try and get it.
Yeah.
And it creates a dangerous situation.
It's just like abortion.
Really. It is.
Is that you can tell women that they can't have an abortion, that's not going to stop them from getting them.
Exactly. And for some women, when when you're trans, it's the same thing. Like, you know. And when you deny somebody who they are or what they want in their life, you're creating a dangerous situation. And that's not your job as a doctor. Your job is the opposite of that.
Mm-hmm. Yeah, I wish we had a personal story about that, actually. Mm-hmm. Because I know that's a really big thing, is that I believe most people that are trans know at a very young age, and they have to go through such a process to, I mean, depending on their environment and their situation, their family life, that I think has a big impact on how things go for them later in life. But at least in what I've read, it's really, really difficult for a trans person to make any sort of transition until they've hit a certain age, because doctors don't want to do it. They don't want to be, they're convinced that it's a phase. Like, I mean, I obviously can't speak from this because it's not my experience, but I've read a lot about those kinds of situations where they know and they're just not believed.
Yeah. And once again, this is a situation where these people aren't, in all of these situations, aren't coming into it on a whim.
Right.
They've thought about this more than any doctor has ever thought about it. Mm-hmm. And they know what's best for them, and we have to trust people.
Nobody's making that kind of decision, like
irrationally, no.
Yeah. Besides the fact that something like making a transition is not even a decision for most people in that situation. It doesn't feel like a decision.
Yeah.
It's just what they know to be right.
Mm-hmm. Yeah, it's so frustrating. Thank you, Bri, for your story.
You're not alone.
You're not alone.
That's an experience that a lot of people have.
Yeah, I personally have, like I said, I've looked into this, and it's so difficult, and
it's not even worth it.
I am not in a position where I can even try. But
yeah, not to mention that it can be expensive because you have to go back over and over again.
And I think that's part of the discouragement is we're going to wear you down on this.
Yeah.
Because for me, it's like I don't actually have the time to be able to go and do all of the preparation that it would take.
Right. Yeah. Thanks, Bri, for your story. Thanks, Bri to Bri.
Bri squared.
I don't know why I said that. That was not.
It's cool. It's cool. You're cool.
I'm so cool. Now we're going to hear from Stephanie, who found us through She Podcasts. She has a podcast called Talk with Stephanie. So let's hear all about Stephanie's experience with doctors.
Hi, I'm Stephanie Calahan, 45, and I live in Illinois, USA. Back in 2008, I was struggling with chronic energy and health issues as well as weight challenges. I had quickly skyrocketed to 235 pounds, and my doctor told me that I would need to eat less. When I tracked my food so he could see what I ate, he told me that I must either be lying to him or to myself, and he even suggested that I was eating too much fast food. The reality was that I hadn't eaten fast food in years. I fired him, and I found someone who would listen to me. You see, it turns out I had unknown food allergies and was malnourished from not eating enough foods my body recognized as food. Once I eliminated those 33 foods like spinach, tomatoes, gluten, turkey, etc., and increased the calories I was eating, 75 pounds of the weight melted off and my energy got significantly better. Today, I work with an outstanding female integrative doctor, and we partner together on my health care.
Well, I'm happy that Stephanie found a doctor that actually listens to her and doesn't say to her that she's lying.
It can be hard to find the right doctor, and it's like you're not spending so much time looking for doctors, and then if you go to one and then it doesn't click, you have to go find another one. It's so frustrating. And then say you switch jobs and you switch insurance, or even just your current job switches insurance, and then your current doctor, you can't go to them anymore.
Yeah. What makes me particularly mad about this is, like, yeah, you're a doctor, but you're not a psychiatrist, and you shouldn't be acting like it. I wouldn't, if I was a doctor and my specialty, something that I specialized in, was, like, I'm gonna make it up, like if I specialized in babies and, like, birthing babies, I would not be like, well, I'm a doctor, I can tell you everything about your teeth.
Right.
I wouldn't do that. You shouldn't do that.
No, you really shouldn't.
Because, like, you've gone to medical school, I get it, and I appreciate it, but that's
but
not
if
your
you
specialty.
don't have a basic trust that your patient is going to tell you the truth, then why are you giving them an assignment that operates on that trust?
Yeah.
Because there's no point to that assignment if you don't trust that they're going to self-report accurately.
Mm-hmm. It was the, like, lying to yourself comment that really pushed me over the edge. That's not...
Dude.
Since you're not a psychiatrist, you probably don't understand the damage that you're actually doing to her by saying that or suggesting that.
Right.
And it's inappropriate. It's inappropriate for anybody to do that, let alone a doctor.
I mean, and if you're the kind of doctor, like, if you don't think they're telling you the truth, maybe you need to look inside yourself. That's how you're treating them, and how the atmosphere that you're creating is not lending it for a space for them to feel like they can be honest.
Yeah.
You know, like, if I'm going to lie to my doctor, it's probably because I think they're going to judge me. Really, like, that's what it is. Like,
yeah. Oh, yeah. I think that a lot of women do that. And then...
Yeah.
And it's for that fear of judgment, because everything in our life is judged.
Right? And, like, oh, God. That kind of reminds me of this one time. I had a doctor ask me if I was sexually active, and I said yes, and then they asked me if I was in a relationship.
None of your fucking business.
I mean, first of all, like, what the fuck does that matter? It has literally nothing to do with my health.
I've had doctors ask me that before, too.
And I said, no, I just have sex with whoever I want. Safely, of course.
Yeah. And
she was so taken aback, and this was a woman. And after that, she just, like, was like, okay, I'm not gonna mess with this girl.
I've had doctors ask me that too, and I've never really understood it.
What's the relevance here? Like, why don't you just ask what you're trying to ask?
Yeah.
Are you asking me if I have multiple sexual partners? Then ask me that. Just ask me that. Why are you asking if I'm in a relationship? That doesn't tell you anything about my sexual history. I could be in an open relationship and be having sex with 5 people a night. I could be in a monogamous relationship and celibate. Like, this doesn't tell you anything about someone's sexuality.
No, it doesn't. I had a female doctor one time ask me if I was in a relationship. I said yes. She said, how long? And I said, several years. And she said, are both of you faithful in the relationship? And I said, I assume. Because, like, no, I have no way of knowing that. Like, I don't.
You can't know that for sure.
You can't know that for sure. And she said, well, there's, like, the way she said it made me so uncomfortable. She said, well, yeah, there's no way to know for sure. Like, she was...
Okay.
The way she said it felt judgy to me. Like, she was somehow judging my relationship that she had no, like, prior history with whatsoever. And made me feel like a dirty person. And that I didn't know what was happening in my life.
Yeah.
It was so bizarre.
Oh, I also had one time this doctor, just go more about doctors judging you. I stopped going to this doctor immediately after this. But I had one doctor do a pap smear. This is very personal. Do a pap smear on me and made a comment on the state of my pubic hair.
What?
Yeah, she said, not a lot of hair down there. That's not very natural. And this was a period of time when I was shaving
I think, fairly regularly down there because that's what I wanted to do. I go through different phases of how I treat my pubic hair based on what I fucking feel like doing because it's my hair and I can do whatever I want. And I was like, are you seriously judging me on the way that I groom my body?
Why the fuck do you care? Like,
how about you just say nothing?
That is, like, pubic hair is 100%, like, based on someone's own choice and decision, and I understand that, like, yeah, it's not natural to shave or whatever, but, like, neither
is shaving your armpits
exactly
or your legs.
It's not, or cutting your fucking hair, or, like, anything that we do for ourselves. Brushing your teeth, that's not natural. That's something that we do to take care of ourselves. Some people, like, okay, I shave right now because it's fucking hot, and if I have a lot of pubic hair, it's gonna be even more uncomfortable for me. And some people, that's fine. They don't care. But for me, I'm just like, get rid of everything on my body that's weighing me down, and a doctor shouldn't fucking care about it.
It's not about my health.
No,
exactly. Why are you making a comment on it? It just made me feel so gross, like, just so uncomfortable and, like, so judged. And after that, like, I'm a different person than I was 6 years ago when that happened. If that happened now, I definitely would have a different reaction, like I did with the doctor that asked me if I was in a relationship. Yeah. Because I'm a lot sassier and, like, I'm not afraid anymore.
Well, I think that comes with age for a lot of women, but when you're younger, you're so self-conscious about everything.
Like, do you not realize that the tiniest comment like that has such an impact?
Exactly. And,
like, you thought so strongly about that you felt you need to say something to me about that. Like, stop policing my body. Yeah. Like, you're here to take care of my health, and that does have to do with my body, but that doesn't mean you get to make comments on the cosmetic appearance of my body.
Exactly.
Sorry, I just got really heated about that. Okay. It's something that still bothers me to this day. I think about it
that
every once in a while.
Too. I just want to say that I really like my gynecologist right now because she's one of the funny doctors. And she's always making jokes when she's, like, in my business. And I'll make jokes back to her. And I looked on Yelp, and I understand that, like, women are, like, I understand that there is a sensitivity that needs to be had there. I'm not like that.
Sure.
Other people are, and I get it. She's not like that either, but I went to Yelp, and, like, all of the negative reviews were about how she's a funny doctor. And they were like, she's just making jokes the entire time she was giving me a pap smear. And the first time I went in, she wasn't, like, making jokes about what was happening between us. She was like, just other jokes. Like, she made a joke about, like, Trump running for president and, like, all this other stuff, but other people were very upset. But I just want to say that I really like my gynecologist right now because she's really funny.
It's not for everybody.
It's not for everybody, but I appreciated her. And, like, I don't know, I just really like her. That's all I want to say. I just like the idea of a funny gynecologist. Sorry to hijack your story, Stephanie. That went off on a tangent.
It did.
We're happy that you found a lady doctor that you're comfortable with and listens to you, because that does not happen for a lot of people.
Listen, ladies, gents too, anybody that's a person or a human, whatever you want to identify with is totally fine with me. But listen, if somebody is telling you their job is to listen to what's going on with you and your body and help you based on the information, and they're telling you or implying that they don't believe or trust you, fire them.
Yeah.
They work for you. If they're not working for you, just get rid of them. You don't need them.
That's what I wanted to say about, I like the way that she said that. I like that she said, so I fired him.
Yeah.
Because not very many, like, I don't say that, but I like hearing that, and I like putting it that way, because it's true. They work for you.
Right.
That is their job. And instead of saying, I stopped seeing them, or I stopped going to them, like, start saying you fired them.
Sure.
You fired them for being bad at their job. And that's okay. You can say that.
You do not need to stick with a doctor that you don't trust and that doesn't make you feel good.
Yeah. Fire him.
Just get rid of him.
Fire him.
Done.
So thank you, Stephanie, for your submission. That is going to do it for our part 1. Please believe me, Doc. Tune in next week for part 2. And if you can, follow us on social media. We are on Instagram, Facebook, and Twitter. Thanks.